Good morning. Good morning. My name is Julia Kong. I write for Radio Nigeria. I'm the health editor. Thank you.
Good day, my name is Jacqueline Boko, and I'm here for TVC News.
Welcome. I'm proud of my work for you, telegraph.
Good morning, sir. I am Vivian Ihuichu. I work with the News Agency of Nigeria, NIMR, and I'm the head of the health desk.
Welcome.
Good morning, sir. My name is Kemi Akitoku. I report for NIMR.
Good morning, sir. My name is Remy Benedict. I'm part of the NIMR Media Chat.
Good morning, sir. My name is Madam Chair.
Good morning, sir. My name is Gloria Ochi-Osuji. I'm part of the NIMR Media Chat.
Good morning, sir. My name is Adede Bisalamo.
Good morning, sir. My name is Angela Omoja. I write for the Punch. I'm the Punch editorial editor.
Good morning, sir. My name is Adela Olaya, health correspondent, Lagos Traffic Radio. Good morning, sir. My name is Roya Ide. I'm the head of the health desk at Leadership Newspaper, Lagos office.
Hello, good morning. I report from the Guardian.
Good morning, everyone. My name is
Thank you so much. Thank you, colleagues. We are still expecting more of our colleagues. In fact, I got a call from this day. She's on her way. So we'll just go straight. Okay, Choma. Okay. We'll just go straight to why we are here. And, sir, the DG, sir, I'd like to inform you that many of these people, they are used to you. They know you very well. Some of them actually covered your events while you were provost at College of Medicine. So you are not a stranger to them. And I can assure you, you are among friends. And the only thing I would say is that as journalists, we want to keep that confidence. We want to make sure that our sources, they have confidence. So whatever we do, and this being an edition of the media chat, we'll see how we report it and see whether we will encourage NIMR to keep up, to keep inviting us every month as we have planned. So I will invite the DG to please go on with this address.
Good morning. Should I say colleagues? I guess we're in the same business of talking about NIMR. Ladies and gentlemen, I welcome us to this session. But before I start, I want to introduce my colleagues who are here with me. As you probably know, I'm not the only person in NIMR, and I can't operate NIMR singularly. To my immediate right is Professor Stella Smith. By the way, she is the most senior researcher in NIMR. You're welcome. To my far right is Professor Iwaloko from the Central Research Laboratory. To my left, Mrs. Keith, the Acting Director of Administration. Next to him is Professor Oliver Ezechi from the Clinical Sciences Department. Of course, it's impossible for me to bring in everybody, all the researchers in NIMR, to this forum. That's why we have only a few people here with me. Of course, the whole idea is to bring NIMR closer to the public. And this is just the inaugural session of what we intend to do over the next couple of months. We expect that on a monthly basis, we'll be able to present to us in a forum like this 2 to 3 researchers talking about what goes on in their various laboratories, what work they are doing. And apart from sitting down to talk, we'll also go around to have a look at the laboratories, researches going on. And where we probably have clinical trials involving some field work. It is hoped that the investigators will have clips of videos to show what is going on in these other locations, and they can share that with us. So, on behalf of Nigeria Institute of Medical Research, I want to welcome us to this inaugural monthly media chat. As you probably know, NIMR is the leading medical research facility in the country. It's recognized across the sub-region of the continent, within the continent. And luckily, we've been having a lot of interactions globally. The vision of NIMR as we know it is to be an institution of excellence in basic, applied, and operational research for the promotion of national health and development in the country. And towards this end, the mission is to conduct research into diseases that are of public health importance within the country and develop structures or platforms for dissemination of such research results. You'll agree with me that this is one such platform to inform the populace what we are doing. As part of the mission, we're supposed to create an enabling environment for research work, training, resulting in the development of human capacity, ensuring cooperation with federal and state institutions, as well as other local and international agencies. We are also expected to collaborate with universities and allied institutions, as well as the organized private sector. Let me start by thanking the federal government for the opportunity given to NIMR to carry out some of these objectives. Apart from the funding level, the ministry has always come in to assist, particularly with interactions with foreign bodies, foreign donors. And for this, I also say a big thank you to our supervising minister, Dr. Ishaq Salako. In NIMR, we have various departments. Apart from service or administrative departments that we cannot do without, I'm talking about administration, that's works and maintenance, the cleaning services, security, and all other support areas. Without them, NIMR cannot operate. But coming to the other specialized areas, which we'll be focusing on over the next couple of months, there's the biochemistry department, actually biochemistry and nutrition. There's molecular biology and biotechnology. We have public health. We have the clinical diagnostic department, and of course we have the clinical sciences department. Each of these departments are served by various experts. I won't get into the details of these experts because we'll be meeting them. But it will suffice to say that various activities are going on in this department. I'll just mention a few briefly. In biochemistry and nutrition department, you have going on in areas of tradomedicine, where you have collaboration and analysis of agents supposedly having therapeutic importance. In that department, there's a vaccine development unit. In that department, you have researchers working on malaria, Of course, talking about malaria, you have researchers even in public health looking at the parasites, the vectors carrying these agents, the genetic makeup of the parasites, why is it that we have the development of resistance to some of the drugs being used? In the Department of Microbiology, you have colleagues who are looking at infectious diseases, be it bacteria or viruses. What are the bacteria that are associated with diarrheal diseases in our environment? What about antimicrobial resistance? Of course, also have the Department of Molecular Biology and Biotechnology. Malaria, what time do the vectors enjoy biting? During the day? Is it? Do they prefer the indoor environment? We interact with the different researchers. We'll get to talk more about this. But the emphasis is to ensure that we are able to relate what we're doing, what happened on the outside. We'll talk about that later. Still, colleagues working on areas of what is the prevalence? Why do we have resistance? What are the peculiarities of these agents? We'll be interacting with colleagues who are working on HIV and how this is affecting the populace. What is it that has been done to improve the health quality of those suffering from this disease? While NIMR is not your typical hospital, teaching hospital, there are individuals suffering from these conditions that are being managed through NIMR, and in the course of doing that, the progress being made, being monitored. What is the viral load? What is the quality of life? These are things that NIMR researchers are looking at. Still on the infections, there are researchers working on viral hemorrhagic fevers, the hepatitis, even the association between viral hepatitis and HIV. There are equipment within the system that are useful for the quantitation and determining the level of determining some specifics about the viral agents. While we have equipment in various places, there are some equipment that are quite difficult to replicate. You can't have them in every area. And that's why NIMR has aggregated some of this equipment into the Central Research Laboratory that ensures analytical cooperation or collaboration across the various departments. That Central Laboratory, Central Research Laboratory is headed by Professor Oladapo. Since Professor Smith is here, I can mention the fact that she's spent a lot of years looking at Helicobacter pylori. That's a particular bacteria that is involved or implicated in the development of gastritis, irritation of the stomach lining. But beyond that, has been associated with the etiology, in part, of carcinoma of the stomach. On my left, I have Professor Oliver Ezechi, a gynecologist who has spent years in looking at maternal and child welfare, adolescents, of course, touching eventually on adolescent health, studying HIV. In this group, also looking at bacterial infection and diarrheal diseases. He's currently involved in a multi-site research work spanning Sokoto, Jigawa, Akwa Ibom, looking at the under 5 years and how the use of certain bacteria might impact positively on the control of diarrheal diseases. I mentioned earlier on that in biochemistry we have the vaccine development area. Currently they are working on developing vaccine for the control of Lassa fever in collaboration with NCDC. It's a long process, and they are still in the preliminary stages. NIMR has been involved in the not just diagnosis, but the development of diagnostic kits. By the way, when we had COVID, the sequencing was first accomplished here in NIMR. People don't know that on the outside. Yes, we are supposed to be a research institute. But the fact still remains that we have to actively work not just with regards to diagnosis, but also surveillance. The work that goes on in NIMR cannot be pushed aside. And I say a big thank you to my colleagues for what they have been busy doing. NIMR was able to develop a diagnostic in COVID, hepatitis B, hepatitis C, HIV, monkeypox, and this ability naturally, if properly commercialized, should limit the need to want to buy these kits from abroad and help to save our meager foreign exchange. And this is probably one of the areas why we need not just the help of the government, but even the private sector to invest in these things. And in the process of investing, one will expect that NIMR will have some financial benefits from it. And not just within the country, but across the sub-region and beyond. Some of us are probably familiar with the recent discussions about the human metapneumovirus, HMPV. We don't have a problem, an outbreak like here in Nigeria at this point in time, but I want to tell us that NIMR is fully prepared, and we have the researchers who are in a position to develop primers and the diagnostic kit for it. We are already in talks with the NCDC towards achieving this objective. It's like NIMR is that expert in the background that people don't see readily. We hope that using a forum like this, we'll be able to get NIMR across to just the average man on the street, but also our legislators who will be charged with the responsibility of funding NIMR. The running of NIMR so far has depended to a large extent, 95% or more, on foreign donors. And when I say foreign donors, it's a long list. Yes, WHO, Bill and Melinda Gates, West African Health Organization, National Institute of Health from the US, London School of Tropical Medicine and Hygiene. We have relationship with Emory University, University of California, and it goes on like that. It is said that he who pays the piper takes the tune. What this means is that most of these researches will be what the foreign donors are interested in, what they want. We need to recalibrate and focus a lot more on issues pertaining to health conditions. And perhaps this is why the government, indeed our legislators, need to approve money to concentrate on local research. And when I say local research, I'm talking about disease conditions like diabetes mellitus, its relationship with hypertension, heart attack. I'm trying to break it down to basic medical conditions. So we are talking about non-communicable diseases. Is there any special genetic predisposition to hypertension in our environment? Are there identifiable genetic constitutions in any part of the country that favors the development of diabetes mellitus? A lot is said about chronic renal diseases and renal failure with dialysis, kidney transplant. Is there anything in our water, in our food, that we need to revisit? Are there genetic predisposition to chronic renal diseases? What about beverages? Every now and then we are told that some people have been discovered in certain hideouts producing adulterated drinks which are being sold to Nigerians. What is the composition? And I want to use this opportunity to appeal or ask anybody who might have anything out there that they want NIMR to look at. We have the facilities to explore these things. What's the composition of the air that we are breathing in the different parts of the country? Can we associate this with specific respiratory conditions? Yes, we talk about bronchial asthma. Are there peculiarities, talking about bronchial asthma, are there peculiarities in different environments across the country that favor these things? A lot has been said about sickle cell disease. Do we have traditional agents that can assist. Short of bone marrow transplant. I'm hoping that this 2025 will be able to further concentrate on research into development of vaccines, not just for Lassa fever, but for some other viral hemorrhagic conditions and malaria as well. A lot is being said out there. A lot is being said out there about some of these vaccines causing reduction in fertility. We probably need to look at these things and most likely disprove such claims so that people can be encouraged to take advantage of the distribution of such vaccines. We have the Cancer Research Lab, the building that is there. I'm hoping that we'll be able to intensify actions in the place with respect to looking at various aspects of cancers of the breast, the prostate, and the cervix. Of course, my personal background is pathology, which is the study of diseases. And I've been involved in the study of breast cancer with some other colleagues, even from outside the country. We have an opportunity to look at these things, and I'm hopeful that with the help of Nigerians and the National Assembly, in terms of funding these things, NIMR will be able to live up to, in fact, live beyond the expectations. All that said, I want to also mention some of the challenges that we'll face. I mentioned the fact that most of our researches are funded by foreign donors. It's hoped that once we have an increase in funding locally, we'll be able to concentrate on health issues that affect Nigerians and less of these esoteric researches. Another big challenge that we have in NIMR is power supply. This so-called Band A has created a lot of problems. Can we imagine a research institute without power? It means that all your research samples that are supposed to be maintained under specific temperature will go bad within 24 hours of power outage. And whatever you might have done in collecting those samples up to that point will go to waste. Without power, the reagents that you are going to use for the process of analyzing those samples those reagents that are temperature sensitive will go bad. And if you are a foreign funder and you are told that your reagents are gone, that the samples are gone, after some time you think of just packing up and going somewhere else. Some equipment are temperature sensitive. The environment within the lab is supposed to be maintained within a narrow range of temperature. If you don't have power, everything is gone. I don't want to keep repeating myself. I've mentioned this to some of the media. The problem NIMR has been having with the electricity distribution company. And when you hear statements like, we'll shut you down, we'll disconnect you, you start wondering, is it that people don't understand what it means? Up till now, NIMR has no meter. Letters have been written about 4 times asking for the so-called skipper panel here to be repaired. Nothing has happened. We've had to even copy the National Electricity Regulation Commission. The first bill that I got in August, that is the consumption for July. The first bill was about 49 million. In September, about 48 million. In October, about 44 million. And you start wondering. In fact, in the process, we discovered some illegal connections, and we had to draw the attention of Eco Electricity to it. You want to arrange for a meeting, and you have been directed to a low-level officer. Or somebody is telling you, if you don't pay by so date, we'll disconnect you. I guess it will only happen in Nigeria. After that, we had a bill for another 44 million, 37 million. And we've had to avoid disconnection, we've had to be asking indirectly the foreign donors to assist to offset the bill. This cannot continue. Of course, we've not been keeping quiet over it. That is, not doing anything ourselves. Even on the inside, we have been looking at ways to shed the load. Telling people to ensure that they switch off the power supply in their labs before going home, whether it's AC, whether it's electric bulbs or whatever, switch it off. Even in the residential areas, by 9 a.m. we disconnect, and then we reconnect at about 4 p.m. when people are supposed to be back home. So it's not as if the NIMR staff are irresponsible about this. They've been very understanding. we are currently making arrangements, discussing with people about the possibility of installing solar systems and inverters. And some of the principal investigators, some of the researchers have contributed towards this by sourcing money to install inverters with solar panels in some of their laboratories. And for this, I say thank you to them. So when you take funding away, the biggest problem that we have is power supply. And I'm hoping that eventually we'll be able to get to a stage where the national grid will just be a backup. Perhaps at this stage, I can assume that I've said enough, and whatever needs to be said will be addressed by way of answering questions. I don't know if any of my colleagues will want to say one or two things.
Good morning, Prof. Thank you. My name is Oladapo. I write for leadership newspaper. So my first question is, I want to find out from your own findings, what are the top 5 endemic diseases we have in Nigeria? Why are they persistent? I mean, government has pumped a lot of money to tackle these diseases, yet they're still here. And what is NIMR going to do to address that? That's my first question. And then you touched something that really affected me recently, malaria resistance. I mean, it's crazy right now because I have someone who I'm treating for like since December, still malaria was wasted a lot of money, just still not going. I mean, what is the solution to this problem? Antibiotics. We are having currently resistance of antibiotics that we rely so much on. I mean, it's so scary right now because the person is still sick since December, still treating, pumping these chemicals on the system, and yet there's no way out. Still sick. Don't know what to do. And let's talk about the funding. It's 90% of the research funding comes from donor. But I know that federal government has some budget for, I don't know if I'm right, I stand to be corrected, for every year, NIMR has some budgets that government fund. I mean, can we get the figure of how much was allocated from federal government to carry out some research here at NIMR? I stand to be corrected. I'm just assuming that it should be funded from federal government, sir. I think yeah, that's the last thing.
So can we take the questions one after the other, or we ask all the questions?
Maybe all the questions, then I'll address them.
Okay.
Yes, ma'am.
Thank you, DJ, for the insight. How NIMR operates, the responsibility and all that. I'm trying to connect the activities on NIMR to the public, because most times you don't get to know what NIMR is doing. But I believe that through this move, we're able to get to know that secret expert you talked about as a NIMR being in terms of fighting infectious diseases and going into researches of public disease of public health importance. But I'm going to take some questions on your ending statement, then I'll look at the vaccine development. Did you, sir? We have been here before, during the time of Professor Oda. We are told that this institute produce a first vaccine, what have you, very soon. since me and Baker and whatever vaccine alliance did not work, NIMR will go into this and that, then vaccine development. So we have been hearing, but I don't know if you can give us a definite term what kind of vaccine that NIMR is going into and probably when we are to expect this vaccine. Then you talked about diagnostic tools. When you talk about private sector, maybe if you can call names and be deeply because the private sector is good. We have the Dangotes and all that. So I know also that last 2-3 years, I think the Natural Medicine Department, they were developing some local solutions to some of these NCDs. I don't know if NIMR has succeeded because we are told we are almost at the last stage. I don't know if anything has come up, like you have the Natural Medicine Department that have been able to formulate about 4 that were launched recently. I don't know if you have had that. Then lastly, sir, the issue of electricity and NIMR. I don't know how to be practical here. You see, we are having a lot of problems there. I don't know if a such scenario is cleared out in NIMR. As we speak, I want to ask DG, is NIMR under threat by the electricity distribution company to disconnect this research institute from power supply? And as you address us this morning, today is 27th, how much is NIMR owing equal electricity distribution? Thank you, sir.
My name is Femi Fabu. There is this new one, HMPV. I would want to know what NIMR is doing about it. And then are there vaccines or treatments already available to tackle its prevalence? Thank you.
Yeah, my question has to do with the withdrawal of HIV funding by the President of the United States. How will it really affect, what's the effect on, or what will be the result and consequence on our research in Nigeria? Does it have anything to do with it? That's my question.
Yes, sir.
Okay. For that question of the power problems, which we want to describe as the biggest problem of at a time when the crisis was so hot, the government announced a kind of 50% rebate or subsidy from the power supply to universities and other research institutions, even colleges of medicine. Does it have any effect on this institute? The second reason, at the point you said it's going to be people, products, and sort of better. You know, this morning you didn't mention anything about the welfare of the staff. How is that?
Yes, ma'am.
So my own interest is, I have an interest in the HMPV virus. I want to know exactly what, new things that Nigeria should know about it, and the strategies for ensuring that, it doesn't spread. Whatever your institution is doing so far concerning this, I'd like to have that information. And then just recently we heard about anthrax in the news. So I want to know how your institution is also approaching that part of it. Those are my areas of interest right now.
I think that should be all.
Well, I thank us for the questions. I'll provide answers, and where my colleagues who will feel like chipping in anything, they're welcome to do so. Something was said about vaccine development. I can say that as of now, the work that has been done is in the area of Lassa fever. It's time consuming. Interestingly, just 2 days ago, I was having a chat with a person in the vaccine laboratory, and we're talking about the time scale for getting specific results, because we still have to go through the whole gamut of animal experiments before we want to now conduct clinical trials in humans. And before we get to that stage of even going into animal experiments, it will take us about 6 to 8 months from now. Now, further to the development, supposedly hasty development of the COVID vaccine in 2021. Some workers in South Africa were charged with the responsibility of helping to develop human capacity and providing equipment in specific regions within the continent to produce vaccines. And Nigeria is one of them. I can tell us that in September, we had a visit from South Africa. It was one of the earliest things that I had to do. And there was bio vaccine here in Nigeria that came with them. And we're supposed to hopefully get some assistance in terms of human capacity development and the equipment that we require to augment whatever we have here. Tomorrow morning, I'm supposed to be meeting with an official of BioVaccine. At this point in time, we still don't have the equipment. I understand that they've been identified. A cost is about to be put to them. And we should have some figures within the next 1 or 2 months. Not to be paid for by NIMR. So we're looking forward to this assistance. I mentioned the fact that NIMR has developed some diagnostic tools. But yes, if we can have private individuals to partner with NIMR to ensure the commercial production, it will go a long way to reduce the dependence on foreign companies or organizations. A question was asked about HMPV. And tied to that was a strategy for Nigeria. I mentioned earlier on that we don't have HMPV on ground in Nigeria at this point in time. The body that is charged with the responsibility of making such declaration or whatever is NCDC. Our role is to provide that support and be ready to walk shoulder to shoulder with NCDC and assist with the diagnosis. Is NIMR ready? The answer is yes. In fact, NCDC contacted NIMR asking if we can make certain things available for the purpose of diagnosis. And the answer was yes. In fact, I set up a committee of 5 people to look into the request by NCDC, come up with details of what we need to do, the financial implications. Incidentally, Prof. Oladapo is a member of that committee. I'm also a co-chair of the committee. But Professor Oladapo, I'll leave him down the line to expatiate on that. I can say that NIMR, again, is able to face the challenge, and we have no fear whatsoever. Staff welfare. Thank you, sir, for raising that question. I can assure you that NIMR management is actively looking at things that affect our staff. I don't need to be specific at this point in time. By the way, there is no dispute, there is no nothing. We had a good handshake at the end of the year with each other. I know that they have their conference coming up, and NIMR management will be cooperating with them as much as possible. This was also discussed. This issue of staff welfare was discussed in Abuja during the budget defense, and certain requests were made at the National Assembly, the respective committee in the House of Rep, what would need to assist particularly our junior staff. It will probably be premature for me to get into details of what we asked for. By the time we have any approval of our requests, of our prayers, I'll be quite happy to openly share it. I don't want to appear as if I'm putting anybody on the spot. But we actually, and again, good enough, Professor Smith is the chairman of your committee. And last year, we were able to take care of our staff. We understand things like accommodation. People are living far off Mowe, Aja, and Co. We have all these things in mind to deal with. There is an area, some derelict buildings or garages, so to say, that we are trying to refurbish and turn into one-bedroom apartments to be able to provide some shelter for junior staff. We know they have to come from far off, And then if they can get any possible assistance to do this, I'm sure they will appreciate it. These are things that we're looking at. So, that said, I think I've addressed virtually all the issues raised, but I don't know if you... No. I don't know, Professor Walokun, if you want to say one or two things about HMPV. Yeah.
Thank you very much, sir. Gentlemen of the press and ladies. I'm a member of the HMPV Preparedness Committee set up by the management of NIMR recently. And I want to tell you that NIMR is working towards that. What we first did was to create an awareness document on HMPV through the Central Research Lab for the purpose of engaging our health professionals that patronize NIMR and of course the media. With permission, we will share that document. The document is highly informative, partly scientific, and I will be willing to also break it down. One of the important content in that document is to address the misinformation that HMPV is another China virus. No, it's not a China virus. We have it as that the virus was first detected as an RNA virus in the Netherlands in 2001. But before that, there is also evidence that it has been with us for over 50 years, people before 2001. So in that document, we stated categorically what NIMR can do. About the committee, NIMR has proactively developed terms of reference and engagement document to work with the Chief Public Health Agency in the country, NCDC. The committee has been set up. We can also give you the information that NCDC has also set up a committee so that we can form a consortium in preparing for it. Just like the DG said that NCDC requested for primers and diagnostic kit for yes. We are in the process of getting the diagnostic kit done. And I must also tell you that it's not just a diagnostic kit to be done, it will be validated and an external quality assurance will be built on that kit. And for that purpose, we have designed different categories of primers. I think one of them is to construct a synthetic RNA of the virus itself, removing some genes that are virulent in that virus and constructing it very long. It's about 1,500 bases. So component of the virus as a construct. We want to use that to validate the kit we develop. Just like the DD said on diagnostics, we are also working towards developing tools for surveillance. There is one thing to detect the virus, another thing is to know the lineages that will come into the country. And that will be done by sequencing. So we have the capability for that. Both the whole genome of the virus, which is not too large, about 13,000 bases. And of course, the key genes, the fusion protein gene and the G-glycoprotein. These are the two that we use to sequence it. So we've also designed the primer. And then we are in the production stage of these primers and probes. Hopefully, we've been given a terms of reference of 6 weeks to get all this done. So in 6 weeks' time, maybe when you come next month, all this will have been on ground. Thank you very much.
Okay.
I don't want to say anything.
Stella, I'm the Director of Research.
Maybe you want to tell them a bit about SAMA?
So just what I want to do is to add to what the DG has mentioned. Somebody talked about antibiotics being given to somebody and there was no cure, it's got resistance consistently. So there are different things that could lead to that. Number one, antibiotic resistance is different from antimicrobial resistance. When we talk about antimicrobial resistance, it includes both bacteria, fungi, parasites, but when we talk of antibiotics, it's just referring to bacteria. So I want to start on that to say that maybe the person who was given the antibiotic, maybe it could have been a viral infection, because in this part of the country, sometimes when you have some viral infection, they prescribe antibiotics. So the antibiotics is not meant to treat that viral infection, unless you have an antiviral agent. Okay, that's one. So number two, maybe the person was asked, I don't know, maybe the person self-prescribed, because that's another problem we have majorly in Nigeria and basically in Africa as a whole. Because in places like South Africa, you can't just go to a pharmacist, a third generation cephalosporin. I want to ask for cephalosporin, and I'm going to the chemist. The chemist will just give it to me here in Nigeria, but you can't do that in South Africa. They probably only give you drugs like painkillers, but you can't have access to drugs like antibiotics. But we have that here in Nigeria, and that's one of the problems, the major problems we have as a country. That's one. Then, if you are asked to take a drug for like 2 weeks, and the person takes it for 2 days, normally sometimes we usually, not Nigerians necessarily, but Africans, we usually could be lazy to complete these drugs for 2 weeks. And then maybe after 2 days, we start feeling okay. We say, what is the point of continuing with these drugs? And that's one of the major problems we have in Nigeria. So if you don't take your drugs and take it to complete full dosage, it will still come back. That means that you are for a minimum of 2 weeks. These are for fake drugs. Of course, if the drugs are not correct, that's also a problem. Malaria, when you go to you have February, oh, you have malaria, they give you. That's one of the problems we're having. That we should really look at, and maybe also the physician or maybe nurse, whoever it is, instead of giving you a drug that possibly could really treat it, they like all those highfalutin drugs, Rivaputine, those very like the extreme, those very expensive ones. Instead of giving you some minimal ones that could actually treat it eventually, they give you those high drugs that you actually need. So it is not good for the system. So there are various things that, I think just on the surface to add to what the DG has said, that will lead to antibiotic resistance.